And the facts show that tooth extractions are the #1 reason for hospital admissions. So one of the myths that we hear in the public domain is that children's teeth don't matter, i.e. milk teeth. We know that's not the case as dentists. But 1 in 4 children suffer from tooth decay before the age of 5. And the facts show that tooth extractions are the #1 reason for hospital admissions. I think it'd be really helpful if you could just describe what is tooth decay, how does it happen, and what are the early signs that parents could see in their children that might have tooth decay.
Absolutely. So tooth decay, simply put, is a hole in the tooth or a cavity in the tooth. And it happens by demineralization of the tooth structure, so the enamel on the outside and the dentine on the inside. And it occurs by when you eat lots of sugars. The bacteria in the mouth essentially eats those sugars and it secretes an acid which causes this demineralization and this breakdown of the tooth structure. So as a parent looking for early signs of it, you're looking for changes in the colour of the teeth, so any brown spots, sometimes even white spots on the teeth can be a sign that you may get a start of tooth decay. Or from a child's point of view, they may be complaining of sensitivity and also just a bit of pain when eating or food getting stuck in places that they haven't noticed before.
Yeah, so if we think about looking after your children's teeth, what kind of tips would you give parents to help their children to maintain good oral health and, looking after themselves?
Absolutely. So a lot of parents come to me and say it's an absolute battle trying to get their child to brush their teeth. And I would say consistency and just trying to embed some sort of routine, even if it is fighting through it. And even if they are just chewing on the toothbrush, it's fine. Just trying to build that consistency and that routine into their lives. But more importantly than actual toothbrushing at a younger age is the diet. So it's trying to reduce their sugars, trying to avoid sugary snacks, so swapping out things like sweets, chocolates, or even hidden sugars in like dried fruits, which on the surface appear healthy but they're awful for teeth, and swapping them out for kind of cheeses, crisps, breadsticks, things like that. But it's, once again, it's having that routine when it comes to diet and making sure if they're going to stay at their grandparents or anything like that, you're reinforcing that good dietary behaviour and trying to reduce all the sugars. Where possible, use a fluoride toothpaste. So use an age-appropriate fluoride toothpaste, but fluoride is one of the most important things when it comes to fighting tooth decay. So we really recommend getting an age-appropriate fluoride toothpaste. But apart from that, it's all about creating healthy habits and routines. So hopefully they'll bring it into their adult life as well.
So in terms of tips for brushing, we talked about how difficult it is to get our children to brush their teeth. And when you try, I always remember that I used to have a saying with my children. And I used to say, we can either do this nicely or we can have the daddy death grip.
Okay.
Where I'd stand behind them, because actually you should stand behind them and you should be looking in a mirror together, not standing in front of them and brushing their teeth. But I'd say, look, I can either do this nicely with you or I can hold your neck in place. Not for everybody, but it worked for me.
I would say, though, also, I think some people allow their children to be too independent too early.
Yeah.
And something I tell people, if they are unable to tie a shoelace, then they should still be supervised to brush their teeth. So it tends to be around that age 7, and that 5 to 6 is the sweet spot, because that's when we're starting to get adult teeth in, and you don't want them to not be brushing properly when they're getting their adult teeth in.
I think that's such an important point, actually, because from the age of 6, the first permanent molar teeth erupt behind, and a lot of parents think that's another milk tooth. They don't realise that that is a tooth that's got to last the whole life, and often those are the first teeth to decay. And I think what people forget, and we often see decay occurring in the younger ages and then not later on so much, and that's because enamel doesn't fully harden until your late teens, early 20s, and so that's a really vulnerable period, especially when teeth first erupt, to ensure that they're being looked after properly. And I know that brushing is really important, as you say. What do you think about there are like apps out there to help children to brush their teeth. I know there's one that one of our dentists created, which was a music app, which you had to brush for 2 minutes. There's others where you kind of painting a picture at the same time as you're brushing. What do you think about those kind of things for children?
I think they're all great. Anything to increase engagement and get them on board with brushing. So yeah, there's lots of free apps online, or just putting a timer on and putting some music on and getting them to sing along. Anything that's going to create engagement with the children to get them, as I said, embedded in that routine is always a winner for me.
Yeah. And in terms of coming to see the dentist, what's your advice about bringing, when they should first bring their children in for a checkup, how that should work, and the kind of process that you follow with parents and their families?
So I normally tell people to try and be in the dental chair by kind of 18 months to 2 years. And it may seem a bit early. Some of them don't have the full sets of teeth, but a lot of it is about acclimatization and getting them used to being in the dentist. So you want it to be a happy place. We don't want to, the first time that they go to a dentist is because they have a big hole and they have to go straight into treatment. We want it to be a place that they come along, they get a sticker, they get to open their mouth with, whether it's with or without their cuddly toy. And it's just a really friendly, familiar place. And once again, it's part of that lifetime routine that we're hoping to instill in them. It also, as they get older, gives us an opportunity to potentially put on something called fluoride varnish, which is a really good kind of super strength toothpaste that boosts those teeth. And as you said, it takes a while for that enamel to really harden. So we tend to advise, as they get a bit older, that we place fluoride varnishes on those adult teeth that are coming through, just to give them that extra strength and protection.
Yeah, no, I think that's a really important point. And the other thing that I'd always say to parents is don't use us as a threat.
Yes.
So, I hear parents saying, if you don't brush your teeth, then you'll have to go to the dentist. And it's like putting the fear of God into these poor children before they even arrive. Whereas what we want them to do, like you say, is have a great experience, have a ride in the chair. I always find children have such great imaginations. Yeah. So you say, imagine you're at the fair, and you are in control of the chair, and you're going to ride in this wonderful chair, having this amazing experience. And they just go with it. They love it. They've got such great imaginations.
Yeah. Off the back of that, I would say language as a parent is really important. So, as you said, don't use the dentist as a threat. We want it to be a positive place. But also don't make promises that we can't necessarily keep. So I would try to avoid terminology like it's not going to hurt or anything like that. You'll notice that dentists won't say that, just because we know it will occasionally, if they do need treatment and if they do need perhaps an injection for whatever reason, it will be a bit of a scratch.
Yeah.
So if you start to promise things that aren't going to happen, or even if you start to introduce ideas like it could hurt, then it suddenly becomes a much more negative space.
Yeah, it's a challenge, because it's not if you're coming in and having a ride in the chair and then you're getting a sticker afterwards and you may get your teeth polished, that's great. But if you need some more treatment, it's about managing those expectations properly and making sure the trust from the child is there the whole way through the process.
Absolutely.